Welcome to It's Your Case, presented by VetCT.com. I'm Amy Zalcman, your radiologist on demand for this week. Today we are looking at a 1-year-old female entire small mixed breed dog who had the misfortune of being attacked by a pit bull approximately 30 minutes ago. Although previously healthy, there is now tissue protruding from some of the bite wounds. The cardiac silhouette is slightly small. The pulmonary vasculature, however, and caudal vena cava are both considered normal. Soft tissue opacity is in the region of the right middle lung lobe on the ventrodorsal view. This is less conspicuous on the right lateral view, where the patient, in right lateral recumbency, would not be fully aerating the right lung. This band of tissue extends to the lateral margin of the thoracic wall. Upon closer inspection, we see that there is some small gas foci along this area that appear to be within the pleural space. Along the right thoracic wall, we see an increase in soft tissue volume. Additionally, the right ninth rib does not follow the typical course, as do the other ribs. This extends to the level of the costochondral junction. At this level, we see the greatest volume of lobulated soft tissue associated with the thoracic wall. This indicates that the support structures, such as the intercostal and overlying musculature, are likely disrupted. Multiple small gas foci are throughout the soft tissues along the right body wall and dorsally as well. Along the cranial abdominal wall, we see that there is also heterogeneous soft tissue and gas, as well as a little bit of gas that tracks along the layers of the abdominal wall. There is an overall mass effect of this soft tissue and gas that results in mild leftward displacement of the margins of the liver. Several of the gas opacities highlight the margins of the liver lobes within the cranial abdomen. In this study, we see the complexities of a big dog, little dog attack. The subcutaneous emphysema indicates the extensive shear force that occurs from the bite wound, which allows for pocketing of gas. The malpositioning of the right ninth rib, paired with the soft tissue thickening and gas in the pleural space, heightens the concern for compromise of the right thoracic wall. These findings can indicate penetrating injury. Additionally, trauma to the right cranial abdominal wall is a possibility given the suspicion of gas contouring to the liver. The regional loss of serosal contrast can reflect regional hemorrhage. In a short period of time since the attack, an inflammatory effusion is considered unlikely. Increased characterization of the wounds can be made with regional sonogram or computed tomography, with some limitation associated with both modalities. Wound exploration is a vital component of management. However, because of the suspicion of penetrating injuries to the body cavities, we should consider this as we prepare the patient for the procedure. Be sure to check out the full report associated with this case. We appreciate your listening and taking the time to view these radiographs with us. Remember, it's your case, so please post any questions on social media.